Hello and welcome to Sikkim this week. I'm Chiring Eden and I'll be talking about the Delta variant of COVID-19 today. With too much information out there regarding COVID-19 and the variants, we are bound to feel burdened and confused in a pandemic that is already characterized by extreme uncertainty. In this episode, we attempt to demystify the Delta variant and answer some of the most frequently asked questions about the COVID variant that has been primarily responsible for the second wave in the country and is now responsible for the increasing number of cases in the state. These are the names given to variants of coronavirus based on the mutations found in them. Delta variant has about 15 to 17 mutations. It was first reported in October 2020 in India. Delta variant is classified as a variant of concern and has now spread to over 100 countries as per WHO. The variant has three subtypes including Delta Plus. The Delta Plus variant contains a new mutation in the spike protein the virus uses to enter human cells. As it's still closely linked to Delta, it's been called Delta Plus. So far, Delta Plus has been found in relatively low numbers. Delta variant, on the other hand, has ravaged the country during the second wave, and it continues to do so as it has been recently found that the Delta variant continues to be the dominant lineage for new cases across the country, while the other variants of concerns are at a lower rate and declining. This variant was also behind 86% of India's breakthrough cases during the second wave. It is known to be the fastest, fittest and most formidable version of the coronavirus the world has encountered. Aside from the Delta Plus variation, 4 new varieties have also gained the attention of health experts such as Lambda and Kappa. Delta is highly transmissible, about 60% more so than the previously dominant Alpha, which was itself more transmissible than the original virus and more virulent. In comparison with the previously dominant virus, Delta produces higher viral load earlier in infection, which may mean that it's even more infectious during the period when people don't yet realize they are infected. It also appears that Delta is more able to cause so-called breakthrough infections in vaccinated people, although fortunately, the resulting infections are comparatively mild. There is some indication that the Delta variant may also result in more severe disease. So yes, Delta is possibly more dangerous than the Alpha variant and twice as likely to lead to hospitalization. The symptoms of the Delta variant appear to be the same as the original version of COVID-19. However, physicians are seeing people getting sicker quicker, especially for younger people. A recent study has found that Delta variant grows more rapidly and to much greater levels in the respiratory tract. Typically, vaccinated people are either asymptomatic or have mild symptoms if they contact the Delta variant. The symptoms are more like those of a common cold, such as cough, fever or headache, with the addition of significant loss of smell. A research conducted in the United Kingdom found that sore throat was the most commonly reported symptom by the patients. Cough was the second most common symptom, followed by nasal congestion, sinus congestion, and then fever. However, the observations in the UK and the scenario in India may be different. AIIMS Director Dr. Randeep Guleria has said they are seeing the same type of symptoms with the Delta variant with no noticeable difference compared to earlier strains. When a fully vaccinated individual gets infected with coronavirus, it is termed a breakthrough case. The reports of fully vaccinated people testing positive for COVID-19 has caused concern for the authorities around the world who were depending on vaccination to contain the virus surge, while the breakthrough COVID cases raise questions about the efficacy of vaccines, especially against the highly contagious Delta variant. Health experts have said they are not a cause for alarm. As per medical findings, it is difficult to determine the reason behind a particular breakthrough case, but viral load could be a factor in such infections. Underlying health conditions or medications taken by the patient could also make the immune system less responsive to the vaccines. However, most people with breakthrough infections experience only mild illness. Vaccines may have shown reduced efficacy against the Delta variant, but it is still good at protecting people from severe illness. A strong reason to get vaccinated. The biggest reason is that the virus they were designed to detect has changed its look and behavior considerably since the last year. RT-PCR tests usually look for more than one part of the coronavirus, but the presence of the virus's genetic variants in a patient sample can potentially change the performance of the test. Inadequate sampling, improper transport, late swabs, varying incubation period, low viral load may miss COVID-19 virus in RT-PCR tests, according to experts. Some are of the opinion that the virus did not colonize the nasal or throat cavity, due to which swab samples taken from these areas didn't yield a positive result. Therefore, it has become all the more crucial that you immediately get in touch with your healthcare provider in case you develop symptoms of the infection. Also, keep a constant tab of your oxygen levels. Get retested after a few days. Even if the symptoms persist, chest CT scan is recommended, especially for those who have got significant respiratory symptoms. This is recommended by doctors and health experts. Scientists say adults are more likely to have serious illness from the Delta variant. However, it's too early to say the same for kids. One reassuring fact is that reports from the American Academy of Pediatrics show that even though the Delta variant is circulating, total cases in children are still down. However, the virus's ability to spread quickly is worrisome, especially for the unvaccinated age group of 18 years and below, including young children. There are several concrete steps that physicians say will limit your child's chances of contracting the Delta variant and COVID-19 in general. You can teach and reinforce everyday preventive actions such as wearing masks, washing hands, and avoiding close contact. However, babies and toddlers under 2 years shouldn't wear a mask as they have smaller airways, so breathing through a mask is difficult for them. You can still protect your little one by avoiding large crowds. In case the child is affected, it is important for parents to stay calm. In most cases in children, the virus sometimes causes only a mild illness and often causes no symptoms at all. Help your child stay physically active and socially connected. One must follow COVID-appropriate behavior, which includes wearing a mask properly, washing hands frequently, and maintaining physical distance, and get vaccinated on time. If you know you have been exposed to or have come in close contact with a COVID-positive person, please self-isolate regardless of whether you have symptoms or not. Get tested within 7 days and inform your doctor. The second wave is not over yet. It is possible to prevent a big third wave provided individuals and society practice protective behavior. All the measures that we have used to date to mitigate the spread of the virus are the best ways to protect against getting COVID-19, whether it is from the Delta variant or any other variant. We hope that the information shared with you today has been useful. Please follow the official page of Government of Sikkim on Facebook for more such relevant information, news and updates on recent developments in the government and the state. Thank you for watching Sikkim This Week.